This is Tiffany with Big Island Now, and I'm speaking with the leaders over at Life Care Center in Hilo. Introduce yourselves, you guys.
Mark Mann, I'm the Executive Director.
And I'm Dr. Gary Johnson. I'm the Medical Director and in-house physician.
Perfect. So tell me what the conditions are like right now overall at Life Care as of today.
As of today, so this is Mark. We've had a total of 51 resident cases. Of those, 43 are currently active in the facility. We have 3 who are currently receiving proactive treatment in the hospital. Unfortunately, we've had 3 deaths, and we have two residents who have discharged from the facility.
Okay. When did you guys start doing the testing twice a week?
It's been some time, mid-September.
Yeah, this is Dr. Johnson, mid-September.
Okay. And is that when you say testing twice a week, is that the entire facility?
Yes, we test the staff. This is Dr. Johnson again. We test the staff twice a week, and we test the, well, we call them residents, but our patients twice a week, and they're not on the same day. It's alternating days.
Oh, okay. Okay.
And if anyone is symptomatic in between those testing intervals, we do the rapid test,
Mm-hmm.
and then we follow it up with the antigen test to confirm the antigen test
Okay.
with the PCR test.
Okay. And so cases started developing in September, correct? Like late September?
Yes.
Yes, I think our first resident positive test occurred. The test was taken on the 23rd of September, and we received the results on the 25th.
Okay. And I know that you guys have worked really hard to amp up, health and safety procedures, but what have been some of those things that you've implemented to stem the spread of the infection in the facility?
So back in early spring, we set up our building to have red, yellow, and green zones. So red zones would be for COVID positive patients. Yellow zone would be for suspected or exposure people of interest. And then our green zones would be for people who, were deemed to be very, very low risk for infection. And so we had those in place and ready to go prior to the outbreak.
Okay. And so you said that you're treating 40-something residents for COVID right now in the facility, correct?
Correct.
Correct.
Yeah. And what zone are they in right now?
All of those individuals are in the red zone.
Okay. All right.
With dedicated staff.
Okay. And I know you mentioned this a little bit earlier, but how many residents are undergoing the early COVID treatment over at Hilo Medical Center?
So we currently have 3 residents receiving treatment at this time. We have 6 residents who have completed the treatment and returned to the facility.
Oh, so 6 overall then?
6 have completed and 9 have participated. 3 are currently at the hospital receiving the treatment.
Okay.
And we likely have 1 other resident gonna begin the program today.
All right. And how, oh, sorry, go ahead.
I'm sorry, Tiffany, I didn't mean to cut in, but this is Dr. Johnson. Yes, the early treatment program at the hospital has been incredibly helpful. And as Mark was saying, we've been able to readmit 6 of the patients we had sent for treatment, and they are all doing well so far.
Oh, great. Great. How long will it take before you know for sure that these individuals have completely recovered? Do you have a time span?
This is Dr. Johnson again. Typically, we think by day 14, but because our patients are frail elderly for the most part, we actually keep them in the red zone, the COVID zone, for a total of 20 days just to make certain before we have them transfer back to another part of the building.
Mhm. And what I know that the treatment is something that the doctors have been normally administering, but you guys are just administering it sooner, correct? That's the concept of just providing the treatment sooner rather than later.
That's correct. And the hospital developed this early treatment option and reached out to me about a week before we had our first patient turn positive. And that first patient that turned positive was actually the first person we sent to the hospital for that treatment program.
Okay. And how is that first person doing?
She's doing very well. In fact, she can, her day 20 will be tomorrow.
Oh, great. Great. And has she been retested to determine if she still has the virus?
Typically, we don't retest because people can still test positive, up to a certain amount of time.
Oh, right.
Usually. So we basically just go by symptoms and the time frame.
Okay. Yeah. And, away from the residents, how are the staff doing? What's the morale like? Because I know that staff, they also are, suffering from some infections. Are they getting the support that they need as far as time off if they need it, and just enough help to care for the residents in the facility?
It's definitely very taxing for our staff. They've been very, very grateful for the community support as we've tried to manage this outbreak. And I can't tell you how much the support means to our staff. We've had people, make signs. We've had people call. People come by. The community's just been very, very supportive. To answer your question, we have sufficient PPE, and we've had sufficient staff. But it is very challenging when you have dedicated staff to zones. That does put a burden on the staff members who are not in that zone. And so it is challenging, no doubt about it. But our staff are here getting tested twice a week. They support each other, just a wonderful team that's committed. We have not had, staff leave work because of COVID. And so we're very grateful for our associates. And of course, their safety is just as important to us as the safety of the residents.
Well, that's good. I'm happy to hear that. Do you anticipate more positives moving forward? More positive cases?
That's a great question. I think the odds are we will have more cases.
Mm-hmm.
We hope that we can tell you that we have peaked, but this is a highly infectious virus, and we are a very large facility. But really, the recent cases have been tied to our secure unit. We're the only secure dementia unit on the island of Hawaii. And so we feel good with where we're at, but we're cautiously optimistic.
Okay.
This is Dr. Johnson, Tiffany. Regarding the dementia units, those are actually 2 units that are locked, and the whole purpose of the units is for people with dementia who are still ambulatory and tend to wander, and are put in these, and we admit them to these units specifically for that purpose. So it's almost impossible to keep a person with dementia who wanders within their room, wearing a mask and all that. So that had always been our biggest concern, was if we started having patients with that tested positive in the dementia units. Yeah.
So everyone in the dementia unit is secured in that part of the facility.
Yes, they do not leave the 2 units.
Okay. All right. I know Dr. Johnson, you and I spoke a couple weeks ago, I guess, just about, you know, how this, virus even got into the facility and what can be done to, keep it out. Can you kind of go over that with me again?
We think that, as I think in many situations, it has been employees that are asymptomatic that have been exposed outside of the building that had initially brought it into the building. And we do screening of everybody who comes into the building. Each employee is, their temperature is taken. They have to fill out, they have to answer certain questions before they come into the building. But unfortunately, as you know, so much of COVID is spread by people that are asymptomatic that, once it's there, it's already happened. It's too late.
Right.
So Tiffany, this is Mark. One thing that's taken us back as we've done our tracking and trending is 2/3 of the cases that we've identified with our testing program have been asymptomatic when they were identified.
Oh, wow. Yeah.
And so that's been eye-opening. So it's given us perspective.
Yeah.
And Tiffany,
Yeah.
this is Dr. Johnson, and even our most frail, vulnerable patients, we're picking them up when they're asymptomatic, when they test positive, and because we're doing it so often now, we can kind of track the time frame better.
Right. Is there anything else you gentlemen would like to add?
This is Dr. Johnson. I would just again like to echo what Mark said. Our community has been tremendously supportive and helpful. Our hospital, our mayor, everybody has just been great in working with us. And we deeply appreciate that. We deeply appreciate the ability to collaborate with the hospital like we've been doing. And also I'd just like to thank you two for taking this time to speak with us and getting our information out.
Oh, absolutely. I really appreciate you guys taking the time. I know that you're busy. So again, it's appreciated.